First of all, let's review what you're using now. You're using something like this. Do you guys leave it in a bag like this?
No.
Do you have them in a tray like this?
No.
How do you have them?
They're in a little Velcro.
So when you go up to a patient to decide which one, you're guessing that that's the one, then you measure it, you go, oh, that's not it. And then you go and you guess another one, you go, oh, that's it. So there's a little time delay in how you're using the product. And so what we've done with the adjustability feature of the airway is eliminate those choices. It's built into the system. So let's go over it, and these are the two with an extra large will be coming soon. This is my own product, and I just started producing it, and so I'm in the works of building the extra large one. I have a pediatric and an adult. The pediatric, if you don't know this, they start at 50 millimeters. These measurements are in the millimeters. This starts at 50 millimeters and goes to 70 with 5 millimeter half steps. You don't get that option in these because they're set in 10 millimeter adjustments. So we say that everybody is different and he has to customize to them. These guys say that everybody's the same, and we just happen to disagree with that. The adult starts at 70, which ends in the pediatric at 70, because there's a crossover on those patients that pediatric size just don't fit this, although they measure out at 70. That gives you an option to cross over to the extra large next size up. The adult goes from 70 up to 100 millimeters with half steps also. There's 8 sizes in this adjustment. The advantages of this is that you can suction down the middle of the pediatric with a 14 French suction catheter, as well as the adult. In fact, you could use an 18 French down the middle. We are really supportive of inserting the airway, clearing the airway by suctioning, and then bagging. The problem is that you guys have done a great job. You get them to the hospital, you walk away going, yoo-hoo, we saved one. And 3 days later, they're in a ventilator in the hospital on a ventilator with an aspiration pneumonia. Because our focus hasn't really been to clear the airway prior to bagging. One of the reasons for that is because of the complications of dealing that. If you've ever tried to pass a suction catheter past one of these, it's difficult. The teeth and tongue get in the way. Down the center isn't so easy. There's resistance there. So clearing the airway is going to become a priority. Inserting is going to be a little different also. Our system allows for you, if you choose to measure, to go on the outside using the package, and it'll give you an idea about where you want to be. But we're saying that most of you guys are going to be in the 100, so we're just going to run this all the way to 100. We're going to go sideways into the mouth, past the teeth of the palatal arch, and we're going to rotate it 90 degrees. Now what that does, it gets my tongue, gets it in the back of the tongue, and then we're going to pull forward, and it's going to retract the tongue. Can everybody see that? I'll start over here again. So it's in there, it's at 100, and now I'm going to start retracting the tongue forward. Can you see the movement forward on that? Everybody see that? Now, I'm saying that this is out of the gag zone. It doesn't cause gagging. And that's where Randy comes in. And if you wouldn't mind coming up, Randy.
Stand back, boys.
Randy's a good.
Breakfast is what, 2 hours ago? It might be okay.
You look like 100 also. So, seriously, if you put this in and it causes you to gag, pull it out right away. We don't want you losing your lunch.
Okay.
How about it?
You want to do it?
No, go ahead. Are you gagging?
Hey, Randy, we're doing it.
Oh my God.
Not as far.
Well, that's not
And that was videotaped.
Yeah, not easy.
Did you feel it?
Oh, yeah, it was right there, like I might want to.
Okay, so there's a brand new.
We haven't practiced this either. I want you to know.
Listen, this is a non-practice script. Here's the adult adjustable airway. You're already out. Does it cause you any gag stimulation at all? Is it comfortable? How's your breathing?
It's ready for waves. This is ready for
No comments from you guys, okay?
So we have a large opening here. The same one you're suctioning down the center port is now your ventilation port. It's very large. It's larger than an inner diameter of a 9 ET tube. So now we're down to what do we do with this product? Well, the American Heart Association doesn't want you to stop CPR. They want you to progressively push, 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 push. And that's great for that first period of time. If you have extra hands, the airway could be inserted, make sure that you're not occluding. The airway could be suctioned. You can prepare for bagging to get ready for that first breath that you're going to be giving. Interruption of CPR is the focus here. So in that process, you decided that you're going to intubate. What interrupts intubation process? Well, suctioning, clearing the airway. Your first look should not be clearing the airway. So now you have this in, clear the airway, hyperoxygenate, pull it, get yourself partially in, tell your CPR guy, hold it a second, insert your ET tube. If you're using a king airway, you still want your airway cleared, doing all that before you insert your king airway. Next, so what do you do for your semi-conscious patients? The ones that just are not quite there or desatting a little bit. You didn't use these other airways because it would cause more problems than what you had before. You didn't have a tool. Now you have a tool. This doesn't cause gagging in most people. There's nothing out there that can say 100%. So I'm saying most people it doesn't cause gagging. So now you have a tool, put this in those people. You can put a non-rebreather on them. It fits over the top of it. You can put, bag for them. You can suction the airway and keep it clear. You can do all those things. What about the person who is in the seizing mode? Well, this is also a bite block feature. You pull that all the way back and it becomes a bite block. The reason we have this movement of this end piece is to give you 10 more millimeters so that you can fit a non-rebreather mask over the top of a person who might be in that position, or your ambu. Just gives you a little bit more room. It will not break off. It's built into the system. What about a spitter? You'll run into them. They're out there. Well, we've been putting a net over the top of them, but how do you give oxygen to somebody like that? Well, you can put this into them if you can get it into them. We have a Velcro head strap system that you can secure it, and you can give them oxygen, non-rebreather, or you can give them a nasal cannula. So, well, the point of this is that this is now a tool, and it's a tool that makes it easier. It gives you some options that you never had before.